I'm Chris Wehr, MD, and I have a functional medicine and anti-aging practice in Orlando, Florida with Body Logic MD. Well, I grew up in a small town in southeastern Ohio, and my grandfather was actually a general practitioner in northern Ohio and graduated from Case Medical School there in 1904. My father went to Ohio State Medical School like I did. After World War II, where he was an Army surgeon, went into thoracic surgery practice. And of course, I was a thoracic and cardiovascular surgeon for 25 years as well. And I think it's interesting going through my grandfather's old textbooks and that sort of thing. I didn't know him personally, but I think that physicians then had less diagnostic capabilities, so they relied more on knowing the patient personally and physical examination. But I think the functional medicine idea, where we look at the person as a whole and try to figure out what biochemical disturbances have caused their problems, is more of a return to my grandfather's way of thinking. And we rely more on an interaction with the patient and getting to know about their diet, their sleep history, their family life, in a way to analyze where their problem came from. I've always been very interested in the patient as a whole, and always wanted to know the insides and outs of the patient more than just what disease they have or what abnormal lab work they have. So this sort of approach was very appealing to me, to be able to interact with people on a more personal basis as a physician. Through the fellowship, I came to learn a tremendous amount about the interaction of all the hormones and the relationship between diet and stress and other external factors that influence hormones. It's a very personalized medical therapy. No two people are alike in their blood levels or their response to hormones. So it's very important to spend a lot of time with the patient, analyze as much as you can about their lifestyle and what's going in their body and what other external influences they have. We do the whole comprehensive analysis of their chemistries, their hormone levels, and then we usually dose them with their hormones and see them back fairly frequently during the first year until their levels are balanced and their symptoms are relieved. Just like hormone therapy, weight loss is also a very individual thing. Calories in, calories out. I mean, most people have tried that and it hasn't worked. That's why they're in my office. So basically I try a tailored approach. Very often their thyroid might be misfunctioning or some other hormonal imbalance, maybe at the bottom of the fact that they can't lose weight or their metabolic rate is very low.
About 2 years ago, it just seemed like everything started to just fall apart. I all of a sudden started feeling like I was 90. My body was achy, everything snapped, crackled, and popped when I moved. I was cold all the time. I just was not right. And one of my girlfriends was doing the bioidentical for different reasons and all that. And so that got me curious. I'm the type of person that reads up on everything, wants to know everything about anything I do. And so I'm like, oh, that's interesting. I'll have to start reading. And so I started reading. I got some books on it. I started reading them thinking, geez, this all just kind of has fallen right into place. It totally makes sense. And so I had done a search for somebody that did bioidentical. I didn't want to take any of the synthetic crap. So I went and got all my labs done and did everything, and I went in for an appointment, and I was really surprised at how out of whack I was. And one of the things that never crossed my mind was my thyroid. And I had been tested before for the TSH levels. Nobody's ever caught it because it always shows up normal. Well, he was totally on top of the new thinking of it's not just that number, but it also has to do with these other numbers that most other doctors don't even check. And as it turned out, it was the case. I wasn't converting some enzymes, so I was hypothyroid, but didn't even know it, and it wouldn't have been, no other doctor would have known it either. And so sure enough, he put me on the thyroid, and that one was probably the biggest difference. I mean, it was amazing. All of a sudden, I got up out of bed and the snap, crackle, and pops all stopped. I was just like, wow. Just the deep aching in my body all went away. The weight started coming off. doing the things that I normally do. I'm almost back down to my normal weight. I feel like I'm 35 now. Instead of feeling like I'm 90, I actually feel younger.
If you have any questions or want more information, you can search on bodylogicmd.com, and you can search by state and find our practice. We're in Orlando, Florida.